Today I'll be taking you guys on nausea and vomiting. We'll look at the physiology and also the pharmacology. So let's start with the physiology. Now, nausea and vomiting, the main regulatory center for vomiting, it's somewhere known as the vomiting center. You can see here I'm painting it with black dots, the vomiting center. So it's from the vomiting center that vomiting reflex is initiated. But vomiting center, it's there are receptors present here, which are majorly muscarinic receptors, but on the next slide, I'll show you more receptors that could likely be found on the vomiting centers. So when muscarinic receptors are stimulated on the vomiting center, then the vomiting reflex is initiated. We have other parts of the body, both in the central part or the peripheral part, that one way or the other affects the vomiting center or stimulates the vomiting center to initiate the vomiting reflex. One of which to mention is the chemoreceptor trigger zone. So that's the first one we'll look at. The chemoreceptor trigger zone, it's an area just close to the vomiting center. You could see it here. It's written, this is it here. It's close, is where the red dot is. It's close to the fourth ventricle, which is the fourth ventricle you're seeing here outlined there. And this area is called the area postrema. That's the area where the chemoreceptor trigger zone is found. It's called the area postrema, and it's outside the blood-brain barrier, so it kind of gets affected by emetic components that are in the bloodstream. Emetic components such as you find and components of cytotoxic drugs, usually those drugs used in cancer chemotherapy. So they tend to stimulate the chemoreceptor trigger zone, and there are several receptors present there. We have the dopamine 2 receptors, we have the NK1 receptors, and we have the 5-HT3 receptor, which is serotonin receptors. Once any of these receptors get stimulated, they kind of send a message to the vomiting center to initiate the vomiting reflex. Another point to know, it's the ear. So let me write ear here, EAR, ear. The ear, there's an organ in the inner ear called the labyrinth. So that's the labyrinth you're seeing here. And on the labyrinth, we have neuronal fibers. They sort of regulate balance, especially the vestibular part of the labyrinth regulates balance. So when there's motion sickness, that somebody is going on a merry-go-round and there's motion sickness, the cranial nerve 8, that's the vestibulocochlear nerve, it's kind of sensed, receives the sensation of the loss of balance sort of, and sends a message to where we call the vestibular center or the vestibular nucleus, located in the region of the pons, somewhere around here. So that's where it's located. That's the pons region here. So when the cranial nerve sends its signals there, they kind of send a message to the chemoreceptor trigger zone or somewhat directly to the vomiting center to initiate vomiting. Another part to note that in the gastrointestinal tract, we have some cytotoxic agents that could be taken in, or substances that sort of irritate the gastrointestinal tract. They stimulate some kind of cells called ECL cells. ECL cells are called enterochromaffin-like cells, and these cells release some sort of chemicals to to uh, to um, to touch their receptors on sensory neurons. So sensory neurons are usually the neurons of the cranial nerve 9 or the cranial nerve 10, and this pick it up and send a message to the vomiting center to initiate vomiting, meaning that there's something irritating in the gut, in the gastrointestinal tract, and we've sensed it. Enterochromaffin like cells that's brought out serotonin, that's 5-HT3, and it has stimulated us, the sensory receptors, and we brought the message to you, and we want you to initiate the vomiting reflex. There are other points that can also stimulate the vomiting center. They are called the higher centers. This region here, they are called the higher centers. That's this cerebellar cortex, the thalamus, the hypothalamus, and these ones, what stimulates them are usually when somebody has pains, when somebody is having some emotional issues like anxiety or depression, even in some cases, and somebody see a pungent smells or kind of a pungent sight rather, and smell something foul. So all these stimulators in the higher centers could initiate the vomiting center to kind of go about with the vomiting reflex. So we'll see what the vomiting reflex entails shortly. Then on the next slide, I want to show you guys just the same thing I've explained, but just showing you the receptors, the several type of receptors present in all the regions that could be one way or the other responsible for vomiting. So starting at the vomiting center, you could see now that the major receptors here, let me change the marker color to red. The major receptors here are 5-HT3, D2, and M receptor, but the major one you can see the one highlighted here in purple, that's the M receptor. So the M receptors are the major ones at the vomiting center. At the chemoreceptor trigger zone, we have 5-HT3 receptors, D2, opioids, M1, and H1 kind of receptors. They're also present here. At the level of the inner ear I mentioned earlier, they send their message to the vestibular nucleus located in the pons. The kind of receptors present there majorly are the M1 and H1 receptors. It ought to be pons and not cerebellum. So change it to pons in your materials or in your notebooks. So this stimulates the vomiting center to initiate the vomiting reflex VR. Then also at level of the higher centers, as you could see here, the higher centers, the receptors there are NK1 receptors and also something we call cannabinoids. So they also have a way to simulate the vomiting centers. And lastly, the gut, that's the pharynx and the small intestine. I told you guys about some irritant factors activating enterochromaffin-like cells, releasing 5-HT3 majorly, which goes forth and also stimulates the vomiting center. So if we should have drugs that would either promote vomiting or drugs that will inhibit vomiting, they would one way or the other work at any point of these receptors we've mentioned here. So let's go and look at them. So let's start with, okay, before we talk about the drugs, let's talk about a briefing about what does the vomiting reflex entails. First thing, once the center is stimulated to initiate the vomiting reflex, there will be the feeling to vomit develop. That's a nausea. Nausea develop. Then the second thing that happens are a group of events kind of linked. The first thing is that there will be a closure of the lower esophageal sphincter. It will be opened rather, not a closure, an opening of the lower esophageal sphincter. So once it's opened, the next thing that happens is that there will be retching occurring as a result of activation of spasmodic contractions of the diaphragm and intercostal muscles combined with closure of the glottis. So that's the next step that will happen. Then third, the vomiting now happens properly.